Hello guys, and welcome back to part 2 of this little mini series I've made for you to get ready for accreditation this year. Today we're going to talk a little bit about the 4 moments of hand hygiene and what it's about, as well as barriers to hand hygiene. So the 4 moments of hand hygiene is actually AHS policy that everybody that interacts with patients must follow. It's kind of a guideline to it's a guide to help you determine when to wash your hands, and it's also determined to be the time at which transmission of microorganisms is at the highest risk, and proper hand hygiene will protect both yourself and the patient. So what exactly are the 4 moments? So number 1, it's before contact with the patient or the patient's environment. Like before you enter a room to do something to interact with the patient, before a clean or aseptic procedure, after body fluid exposure risk, and also after contact with the patient or the patient's environment. So before, during, after, and for procedures. You pretty much want to wash your hands all the time before and after interacting with someone. And you'll be good and safe for reducing the risk of microorganism transmission. So some barriers to hand hygiene. Gloves can provide a false sense of safety. For example, some people leave gloves on and proceed to the next patient without removing their gloves. I think this is not common, but it is done sometimes. Sometimes nurses feel really rushed maybe and need to treat one patient, and then maybe they're running out of time, so they run into the next room and do a task on another patient without changing their gloves. This should not be done, and it's very obvious that that's a very, very perfect way to create nosocomial infections. And I think almost everybody's really diligent with this, and this is a very rare thing that happens, but it does happen, so that's why I'm mentioning it. So, they must be removed between each patient and perform proper hand hygiene before putting a new pair of gloves on. So, there's some instances where gloves should only be worn when you might be exposed to blood or body fluids, when providing care to patients on extra precautionary measures, or when performing invasive or sterile procedures. You can also wear gloves if you're just not comfortable touching someone or whatever. That's fine too, but even when gloves are permitted, hand hygiene must be performed before putting gloves on and after they're taken off. Before and after. So some more barriers. Never apply hand sanitizer on top of gloves, as this can compromise the glove material and it doesn't make your gloves new again. It's just take your gloves off, do proper hand hygiene, and get a new pair of gloves if you need. Hand jewelry as well is a barrier for performing proper hand hygiene. I think this is really commonly seen. A lot of people wear hand jewelry, and especially jewelry with big diamonds and very fancy metalwork and stuff. And all these big diamonds and designs and stuff, little nooks and crannies, they're a perfect location for bacterial colonization. It's really hard to properly clean wedding bands in these areas and stuff. So it's really recommended to not have any hand jewelry at all. I think AHS does allow you to have a plain wedding band on, but just be really diligent in cleaning. Taking it off, cleaning it. As well as artificial nails, nail enhancements, and chipped nails. I had a lab instructor that was really strict on this. She really drilled into us how gross it was to have artificial nails, or just long nails in general, just because bugs can collect underneath your nails, and just because of the curvature or whatever, it's just a hard location to properly clean. So artificial nails, nail enhancements, and chipped nail polish. The chipped nail polish is just nooks and crannies. It's more surface area for the bugs to attach to and grow. Yeah. So as well, both hand jewelry and nail accessories are proven to be associated with nosocomial infections. It's pretty common knowledge. So some other barriers. Some people experience skin irritation from hand hygiene. It's most commonly associated with frequent hand washing with soap and water. This dries out your skin, and like frequent soap and water washing dries out your skin by eliminating your natural, oils on your skin. Then your skin can crack, and that will become a portal of entry for bugs. So you don't want to wash with soap and water too often. So it's recommended to use alcohol-based hand rub. So weather can increase skin irritation as well. We live in a really cold and dry climate in Edmonton, and can make people more sensitive to irritation. To fight dryness in the wintertime, you can wear mittens. It'll keep your hands a little bit more moist, as well as use hand moisturizer to fight the dryness. So again, AHS promotes alcohol-based hand rub because it contains emollients. I'm probably saying it wrong, but it's just moisturizers inside it that'll help people fight dryness. I think it's a common misconception that people think soap and water is better for you for fighting dryness. They think that alcohol dries your skin out, but this is actually false. It's the other way around. Soap and water is still really good, just it dries your hand out if you do it too much. Alcohol-based hand rub has this moisturizer, so it's actually better to keep your skin healthy. As well as adequate hydration. You should be drinking lots of water. We're very active in our duties throughout the day. And just water is generally good for everything. Just drink lots of water. Thank you so much for listening to my rant again. I'm glad you guys are watching this. And yeah, here's my references. And I hope you guys have a safe and great day. Later.